Thank you, Bill. I'm president of Iowa Farmers Union here in Iowa, and we're also part of National Farmers Union, 250,000 members, nationwide family farms and ranchers. And healthcare, as everybody knows in this country, is a mess. At the rural level and small town rural level, I look at it as a disaster and a broken system. Not saying the nurses and the doctors and the caretakers that's not the problem here, it's the structure of the system. And when you're in rural America, whether it's small town or a family farm, you have two choices, and the first choice is no insurance. The second choice is when you gotta go out and acquire this on your own, it's high-cost individual private market insurance, and that's what I'm stuck with. Lots of people are stuck with that out here in the rural areas, and what I have for a product is a high-cost, high-deductible, catastrophic insurance. And over the years farming, we have as a family went without insurance. At times we've had insurance. It all depends on the profits on the farm and what you can afford for the year. And through that process, as we've got older, we have acquired more health issues, I guess, problems as you get older. And I'm to the point now where I am uninsurable. And I only have one choice, one source. That's HIP 1 of Iowa, the Iowa Subsidized Insurance Program, when you cannot go out acquire insurance because of health. And what I pay a month is approximately $500. That's just for me alone. And the wife, she's still with private insurance, but her rates went up 42% last year because she has some health issues, and she's paying a little bit under $500. So you can see what our health care costs are a year. And when you get that high of a deductible and that high of a copay, you never want to utilize the insurance because you got to cough up that $2,500 deductible up front, and you got the 80-20 to worry about after that. So, you know, this works against the theory out there of preventative health care. And one of the problems with health care is only 4% of the money spent on preventative health care in this country. So that only leads to bigger problems and higher insurance and worse things for families and worse health impacts and more costs. You know, it just goes on and on and on. So that's kind of my story. And, you know, I'm one of them guys that I have medical debt, and because of the insurance, and so that's what's going on out here. Thank you much.
Thank you so much, Chris, for coming out here to Huxley with us and sharing your personal story with us. Next, I'd like to introduce Becky Perkovich. She is one of our volunteers in Boone County. She's our Boone County coordinator, and she's absolutely a wonderful advocate for healthcare reform. Becky.
Hello. As Andrew said, my name is Becky Perkovich, and I grew up about 10 miles from here, an Iowa resident my whole life, and I've worked in direct healthcare for the last 10 years. Over the course of that time, I've seen obviously the number of uninsured people rise dramatically, people who change jobs and don't have coverage, or leave school and don't have coverage until that gap between college and your full-time employment. And additionally, we've seen the number of people who don't seek treatment rise considerably as well. Don't seek treatment for a small problem like nutrition counseling for a diabetic versus treating an illness like diabetes. So some of those things are dramatically increasing. Also, the rising costs of seeking treatment is probably one of the number one reasons that people don't. Those costs, as those costs continue to go up, you just hope that nothing bad actually happens. Because when you need your insurance, it's really not there for you. It's not the benefit that you need it to be. Therefore, I am an advocate for quality, effective healthcare. Thank you.
Thank you so much, Becky. One of the points we're trying to make here is that it is just unfair that it's not fair at all for a hardworking person in this country who plays by the rules and pays taxes and works hard every day to be denied access to health care that they can afford. There's something that needs to be done about this healthcare system. We've got to get out and caucus for a healthcare candidate. We're asking all of our healthcare voters, every one of you, to get out on January 3rd and nominate a candidate, a healthcare candidate.